My research interests are around applied research in dementia, so that means research that's directly applicable to the lives of people with dementia and their families and those who care for them. So research that's around care and how to improve that, or how to understand the needs and experiences of people with dementia and use that to make life better. In particular, my research has focused around care homes and hospitals and how to improve quality of care in those formal care settings. So looking at interventions that staff can implement within those settings to try and improve care, and also looking at staff training and education and how we can better upskill the workforce to be able to deliver better quality care for people with dementia. The scale of dementia in the UK is that there's an estimate of around 850,000 people who are currently living with dementia across the country. So this is quite a significant minority of older people. The risks of getting dementia increase the older somebody gets. So as we've got an ageing population, the numbers of people with dementia are likely to increase. In terms of the challenges that poses, there's huge challenges on healthcare services. We all know how the NHS is struggling to cope with the demands of a growing population. Older people don't just have dementia, they often have a lot of other health conditions. So even if people with dementia are accessing hospital, it might not necessarily be for their dementia. They could have fallen and have a fractured hip, they could have pneumonia or another acute illness, and there are lots of other physical health problems. So we're finding that in hospitals, staff who might be on a surgical ward or an orthopaedic ward are having to try and meet the needs of people with dementia that they might not have had the skills and training to be able to actually do within that quite restrictive environment of a hospital setting where you've got lots of other people who don't have dementia. In terms of care homes and social care, there's a huge amount of care that's provided by families and relatives and informal caregivers, but sometimes they can't cope any longer with caring for the person at home, or the needs of the person are too great, and that means they need some input from social care services. So that could be domiciliary care, where people go into the home to help with meals and getting people up and dressed, or it could be as much as needing residential care permanently. The problems that society's facing at the moment with that is the costs of that. It's a huge cost to put somebody in formal residential care permanently, and so we're getting higher and higher levels of need before people are actually allowed to move into residential care. But looking forward, how are we, with this growing ageing population and growing numbers of people with dementia, one of the big concerns for government is how are we going to afford to actually pay for these services, and how can we afford for these services to be really good quality so people get a really good experience in their last years of their life. Dementia's what we call an umbrella term, so it's a bit like the term cancer. There's lots of different types of cancer that people can have. You can have lung cancer, it's different from having leukemia, but it still falls under the umbrella of cancer, and it's the same for dementia. Dementia is a term that describes the condition, and under that there are a lot of different disease categories. So the most common is Alzheimer's disease, that most people will have heard of, but often people muddle that with dementia and they think they're one and the same thing. But other people may have vascular dementia, there's dementia with Lewy bodies, and then a whole range of less common dementias. So in total there's about 100 different types of diseases that fall under the umbrella of dementia. Each of those disease categories affects people in different ways. So with Alzheimer's disease, the effect's likely to be more what we call global. So people don't just have problems with memory, they might have problems with reasoning, perception, doing things in a certain order and processing information. So it's a kind of global effect on their daily life because of the global effect on the brain. Whereas with vascular dementia, that's often caused by either a mini stroke or a blood clot in a certain area of the brain. So people might have, say, word finding difficulties, but they might have no problems with their memory at all. So it affects people very differently depending on the type of dementia they have. And obviously every person's different, so every person with Alzheimer's disease doesn't experience dementia in the same way. Then their needs will depend on their life history and their background and their experiences, any other health problems they've got, their personality and how they cope with challenges in life. So it's quite a complex picture, and there's no one way to say this is what dementia's like for people, because it's individual and different for every person. Within the Prime Minister's Challenge, the National Dementia Strategy and a number of other documents, there's been a real emphasis on the need to train the dementia care workforce to deliver better quality care, whether that be in hospital settings or care home environments. What we do know is there's a huge amount of dementia training available out there. What we don't know is how effective that is. We know some of the training is probably not very good quality. We know some of it's probably much better quality. But there's very little evidence out there about what's really working in terms of giving staff better knowledge and skills about dementia, changing their attitudes and actually their practices, but also most importantly, what happens in terms of patient outcomes. So for the person with dementia who's using the hospital service or in that care home, has that training made a difference to the care that they receive? So this study is about looking at the available evidence we've got and to see what we already know about what works in training education for the dementia workforce. It's about scoping out what's out there in England and currently being provided, and from that then looking at the best models to find out what it is that really makes that work. And we expect that's likely to involve a number of factors beyond just the training package itself, but the environment and the setting that takes place in and the supports to help staff implement the training into actual practice. So we're going to be looking at quite complex case studies in a number of settings to be able to unpick what works and what really makes things work in dementia training. It's going to be a 3-year study. It's involving 3 universities, so being led here by myself at Leeds Beckett University, but in collaboration with people I've got a long-standing research record with at the University of Bradford and at the University of Leeds. It's funded by the Department of Health, but it's been commissioned by Health Education England. And one of the biggest components of that we need people to engage with is the survey component, which is looking at what training's out there already being delivered in the field of dementia care. So the first part of that is going to be to get people to tell us about training that they're delivering within their organisations or that they as a training provider are delivering around dementia care. And particularly we want it to relate to the 3 tiers of dementia education that Health Education England have set out in their dementia project and strategy. So we'll be providing further details on that. The project's been funded by Health Education England in collaboration with the Department of Health, and Health Education England are responsible for commissioning and setting the policy and the targets for education of the healthcare workforce, so people who are going into training to be health professionals, but also those who are already working in the field as nurses or doctors or other health professionals. So this project is going to inform their commissioning moving forward, because obviously they only want to invest in and commission programmes of training that are most likely to lead to good patient outcomes. It's going to help develop policy around what we do around dementia training and education, but also potentially more widely, because the project will look at what are the elements that makes it possible to embed any training really into practice in the real world. So it's going to be useful for training providers, for the government, for higher education providers, and for organisations that are providing health and social care.